We both work in hospital, and David and I, we've both been very lucky. We've been part of the UH pilot study. So we've had students who've come to us for 1 or 2 week placements. So we've had experience of how it works in practice. So when we looked at this, we looked at enablers, barriers, solutions from the perspective of what would stop the placements from being successful, what would enable them to be better, and what solutions we've come up with. And although we have a lot of white on our sheet, I think we've got some quite focused ideas. So with enablers, we thought post-COVID, we've had a great opportunity to do remote training, lots of digital transformation, and that's enabled us to do a lot of training for, say, new starters or new team members from home, so that they come onto placement ready to roll. So we think that would be a great enabler to tap into, and maybe it would be quite a big investment initially, but if we could use quite a bit of time to do maybe pre-recorded training or kind of remote, recordings of simulations, or even real patient recordings with consent, then that would help to give them that pre-experience before they actually come on board, so we can maximise that limited time that they have with us. We've also talked about, in terms of the change in focus in MPharm, a lot of the pharmacy courses have probably changed quite a bit over the years. So when I was there as a dinosaur age, we did a lot of theory. Whereas one of my colleagues was saying that now they're actually embedding a lot of the pre-training, or they're working alongside medics, so they are applying the knowledge along the way. And I think we need to do a bit more of that, so that we change the style of teaching or the training at undergraduate level, so that that can be more powerful when they come on board as employees or as students. In terms of other enablers, from what we noticed, we think we need to probably embed a bit more of professionalism and etiquette for the students at undergraduate level. So again, when they come on board, they're not just academics, but they have that ability to communicate to patients from the beginning. What we found, we all know, the first class honour students that we had in our year who were brilliant at sitting down and passing the exams, but when it came to talking to the patient, they couldn't relay that in practice. So for me, that would be something that we've missed a trick there, that we haven't actually tapped into that. And of course, the digital enablers, we have a lot of resources at our fingertips, which will free up our time if we invest in that digital transformation from the go-get barriers.
Right. So obviously, common theme throughout the past couple of talks is the lack of staff. Pharmacists don't go in trees, so we need to be able to utilise, which is kind of barriers and solutions at the same time. Lack of staff, we want to utilise the kind of wider MDT, kind of emphasise on some of the degrees previously that have involved in interdisciplinary working with nurses, physios, etc., to kind of help manage the increased workload of the students coming to see us. We also need to think about our kind of competency mix or skill mix of even within the pharmacy department. We also have quite in the current kind of experiences. I'm seeing a lot of kind of more junior members going up to quite high positions. So we actually need to make sure that we have got people in place to adequately provide the training to these students, and that's where maybe we can a programme with maybe universities, etc., to try and actually make sure we've got some kind of competency framework to make sure that we've got the best people for that would really help. We had a PCN colleague with us, and he really emphasised remote working, and there's kind of a lack of, where the students, you can't exactly invite the student to the person's house to do that training. So actually, where are they going to be? An idea. In terms of solutions,
yeah. So as David said, I guess one of our big moan as a profession is we don't have the funding, we don't have the staff, and one of the questions raised by a colleague was actually, we're getting this £25 a day, and what if you did get 4 times the amount and you got £100 a day? What are you going to do with that extra funding? So we need to have a structure in place to use that extra money effectively, and not just say, okay, we've got the extra pot. We need a plan where we maybe invest in extra colleagues, or we invest in someone who's given some sort of incentive to take on that training role. We talked about a bit like when you go into, when you're a prescriber, you've been given that title, so you've got those extra responsibilities. But what do you get for being a trainer? You're just doing your day job plus your training on top. So when you think about how we can incentivise that for colleagues as a solution, in terms of the lack of continuity between schools of pharmacy, we put that down as a barrier because we felt there's maybe not, I mean, I might be wrong here, Kelly could correct me, but perhaps each school of pharmacy does things slightly differently. And maybe if we did streamline that and we had a similar thread running through all the schools, then we can ensure that our students as a whole national cohort come out in the same kind of way that we'd expect them to be ready for workforce ready. So for example, you might get some very academic schools of pharmacy, what I consider very academic, versus very practice-based ones. But if we all had the same kind of, same curriculum, then we could come out in a more uniform manner and we could work with them in that way. Anything else? Use of MDT staff, which David said, and that's a brilliant resource. So we can tap into, as someone else alluded to, OTs, physios, paramedics. Use them to do part of our training. We don't need to do everything. And of course, our technicians, a big underused resource. We don't give our technicians enough exposure, I think. A lot of them possibly are staying on ward-based roles, but they actually have a brilliant capacity to do training for us. Why not use them? And that frees up the pharmacist's time.